Well, we don't actually know what causes immune thrombocytopenia. That's the problem. It's a very mysterious disease. Diagnosis is not great because it's a diagnosis of exclusion, which means we have to do many blood tests and other investigations to rule out certain things like cancer or deficiencies, and then we're left with this diagnosis. So as I say, it's a diagnosis of exclusion. There is no positive diagnostic test for this condition. Well, there are many treatment options for ITP. Historically, steroids have been used, corticosteroids, and we still use those today initially in patients. We also have immunosuppressive therapies, which again we've used for 20, 30 or 40 years, and some of those are still used today. But there are several groups of new drugs that have come through in the last 15 years to address this, which are not steroid related and they're not immunosuppressants. So the treatment options are wide, but what's coming through now is much better than what we've had for a long time. So the outlook for patients is very much better on the modern therapies for this condition. Well, anemia simply means a low hemoglobin, and there are hundreds of causes, which we can't go into just now. But I guess the commonest worldwide would be something like iron deficiency, where the body has insufficient iron to make red cells. And this is very common, especially in females because of menstruation. Every time someone has a period, they lose iron during the period. So iron deficiency is very common on a worldwide basis. But there are many other causes. Deficiencies of vitamins and minerals, vitamin B12, folic acid. There are other things which can be infection can cause it. There are bone marrow disorders. There are many bone marrow disorders which cause anemia. I'm thinking leukemias, lymphomas, myeloma, and then even other tumors like breast cancer, bowel cancer, which can go into the bone marrow. So anemia is a very wide spectrum of disorders. And then, of course, there are the hereditary forms, which would be thalassemia and sickle cell disease. So we break it down into various types of anemia based on the diagnosis that we do. We do blood tests and we look at the results, and that gives us a rough idea what area we're in, and then we do more specialized investigation to work out what the exact cause is for that patient. But it's a complex diagnostic process because there are hundreds, literally hundreds of causes of anemia. Well, low testosterone is common in the population. From the age of about 30, men's testosterone levels will drop annually. And by the time someone's 50 or 60, their testosterone level will be the lower end of normal, or maybe just slightly below normal. And what happens is men will tend to slow down. They will lose their focus a bit, their focus and their drive and ambition. They often tend to gain weight, especially around the middle. They get a bit of a beer belly, even if they don't drink beer, and then they get visceral fat accumulation around the organs like the liver and the kidneys and the heart, and then they can develop insulin resistance, which is a type 2 diabetes, which is very, very common. And within the population, I would say that this is probably 60, 70% of men over the age of 50 or 60, or maybe even a high percentage, will have these features. They've all got the low testosterone type syndrome. I prefer things like natural methods, like, for example, sleeping well. Low sleep is not good for testosterone. It's during sleep that we produce a lot of our testosterone. So a good night's sleep. Optimize weight, bring your weight down through clean diet, sort the diet out, and some exercise. Lifting weights. A lot of people don't want to lift weights, and I know it's not the most fun activity in the world, but certainly lifting weights in a gym will boost testosterone. So these very simple measures alone will help a lot, because the weight will drop, the testosterone level will rise a bit, and then men will feel much better and much more confident. They'll lose their belly, or at least it will reduce, and so they'll feel much more confident in their clothes. In terms of medical interventions, of course, we can offer things like testosterone replacement therapy, which is in the form of either gels, which men apply to the skin every day, or can be by injections 4 times a year, which keeps the testosterone in the normal range. And again, that will help weight loss and focus and motivation and drive and libido.